Today we will be discussing some of the most prevalent STIs, including chlamydia, syphilis, and gonorrhea. This chart outlines modes of transmission, signs and symptoms, and consequences of leaving the infections untreated. All three of these infections can be spread through oral, vaginal, and anal intercourse, and additionally they can be spread from mother to baby during birth. All three of these infections can manifest with symptoms, but they can also present asymptomatically, meaning that the person infected never experiences any symptoms. If these infections are left untreated, there can be very serious consequences, including death.
STD rates are becoming more and more of an issue. Over the past year in Minnesota, gonorrhea rates have increased by 25%, syphilis rates have increased by 30%, and over the past 10 years, chlamydia rates have raised by 71%. Chlamydia is the most common STD in Minnesota, according to the Minnesota Department of Health. But who's affected by STDs? The short answer is basically anyone who's sexually active is at risk of contracting an STD. There are some populations that are more at risk than others, though. The age range that is most at risk are 20 to 24-year-olds, with females being more affected by chlamydia more than males, and males being more affected by gonorrhea and syphilis. Of the males who have syphilis, 77% are men who have sex with other men. Unfortunately, people of color are disproportionately affected by STDs. They are affected 9.5 times more than white people for chlamydia and 18 times more for gonorrhea. This is not because they are more susceptible, but because of a thing called social determinants of health.
The social determinants of health are the conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. There are four big social determinants of health that influence STD rates. They are access to healthcare services, socioeconomic conditions, education, and social norms and attitudes. Access to high-quality healthcare services is essential for early detection and treatment and behavior change counseling for STDs. Groups with high rates of sexually transmitted diseases tend to be the same groups who have limited access to healthcare services. Socioeconomic conditions are also a large determinant of STD infection, as STDs disproportionately affect those who are financially disadvantaged. People who cannot afford basic needs may have trouble affording quality services for STD treatment or preventative items such as condoms. Education is also a noteworthy social determinant because education about safe sex habits and STD testing are important for preventing and treating sexually transmitted diseases. Finally, social norms and attitudes have a big impact on STDs as well. How can we overcome all of these social determinants of health and prevent the spread of sexually transmitted diseases?
Some strategies to prevent STDs include getting regularly tested at places such as Planned Parenthood, which offer free or reduced testing, increasing education, which can help decrease the rate of STDs in communities, eliminating the stigma around asking your partner to get tested regularly, as well as asking to use a condom, and the use of dental dams, condoms, and other safe sex practices. Two recommendations for us as public health nurses in reducing the prevalence of STDs in our community include educating our clients on safe sex practices as well as signs and symptoms of STDs, and advocating that they get screened and tested if they are sexually active.